Okay, let's look at eating for fat loss around your menstrual cycle. So we know, especially the 7 days leading up to your period, hormones are going to drop off. There's a lot of changes physiologically, chemicals in the brain drop off, all of which lead you to unfortunately feeling very hungry, cravings get very high, and your appetite signals can get lower. So there's a few things we can do to stay in the game around this time of the month. So the first thing what we can do is make sure we're eating enough protein and vegetables. Okay, that's the key, because we know our appetite's going to get bigger around this time of the month, so we want to make sure that we have lots of foods in there that are going to keep us full and satiated. So again, that's why we're still aiming to hit our protein target of around 2 grams per kilo of body weight per day, and we're trying to get vegetables with every meal if possible. The second thing what we can do is we can actually increase the carbohydrate content within those calories, because we know one of the chemicals that drops off, there's a conundrum of things that leads up to it, but one of the things that drops down is serotonin and dopamine. Serotonin a bit more, and that's what leads you to craving for chocolate, because chocolate will obviously increase serotonin in the brain, the happy chemical. Now, one thing we can do is increase carbohydrates within the calories that we're eating. Okay, when we have more carbohydrates, theorize we have a little bit more serotonin as well, so we're less likely to go and look for it through junk food. So we could go 40 to 50% of our calories coming from carbohydrates, and obviously majority of those carbohydrates we want to be veggies, fibrous carbs, low calorie, high nutritious, high voluminous carbohydrates. And the majority being low-cal, high-voluminous carbohydrates: potato, sweet potato, brown rice, pumpkin, oats, veggies. Again, it's going to increase serotonin in the brain, but it's also going to give us the illusion that we're eating lots of food, which is the key to keep us full and satiated. So again, someone may have oats for breakfast with protein powder and berries, whatever, getting some kind of protein in there as well, because you want to make sure you get protein. For lunch, it could be chicken and brown rice and some veggies, broccoli, and then for dinner it could be white fish, salmon with some sweet potato and some more veggies. So you're getting carbohydrates every meal, and it also, so serotonin is not only affected, but our blood sugar is also affected during this time of the month. And when we have more low GI carbohydrates with protein, it keeps our blood sugar stable for longer. Again, when our blood sugar is up and down, that will impact on cravings even more. Now, funny enough, during this time of the month, we're actually burning more calories. So your metabolic rate goes up during this week by sometimes 100, even to 300, 100 to 300 calories. Again, depending on body size, etc. So you're burning more calories, hence why your appetite goes up a little bit. So if you've done these two and your cravings and hunger are still off the charts, then what you can do is you can actually increase your calories during this week by 100 to 300 calories. Again, trying to get them from majority carbohydrates and then making sure we're hitting our protein and veggies. Lastly, you've tried these three, your hunger and cravings are still off the charts, then what we can do? Well, we can actually bring our calories we can bring our calories up to maintenance. So that would roughly be 500 calories on top of what your deficit is. But what you can do is you can also use the following calculation, which would be body weight in pounds times 14. And you can do that for 7 days. So that would be a maintenance week. Now obviously you may not be losing that week, but the idea is to keep you in the game and stop you from binging out. So what a plan would look like: 3 weeks deficit and 1 week's maintenance. This has worked very, very well for people I've used it with who could never get the hunger and cravings around this week under control. And actually psychologically as well, when you're in the deficit for these weeks, if you wanted to, you could actually make your deficit a little bit bigger. Now obviously I would coach you, I'm going to coach you through all of this. But if, for example, your calorie deficit is 2,000, well actually we may go 1,500 for these 3 weeks to push our deficit a little bit more, because we know we're going to get a week at maintenance calories at around 2,500, rough estimate, okay? So go in order of these: protein, veggies, increase your carbohydrate content, increase your calories slightly, and then bring your calories back to maintenance. Now these will be the main rocks starting off that we will look at for a menstrual cycle. I'm going to do a part 2 in this video of all the other lifestyle factors that we've talked about before, which will impact on this week even more, that we also need to get under control if it's having a big negative impact on us maintaining a deficit.